So, welcome to one and all on this amazing session, which is going to be on aches, pains, and migraines. My name is Supraja. I am a nutritionist and a holistic health coach, and I'm the host for today's session. Before we start, I do want to share a little bit about my own health journey, especially when it comes to, the aches and pains. So, I was 32 years old when I was training for my first half marathon. And every time I would run, I would experience a knee pain. My left knee would start hurting. A few meters into the run, and I would start hurting. So I went to an orthopedic, just like all of us do. And to my surprise, I was told that I have early stages of osteoarthritis. Now, at that young an age, it came as a shock, and the doctor told me that I'm not supposed to run anymore. But all that changed when I decided to take charge of my own health. And, I've done since then multiple, at least 4 half marathons, multiple 10K runs, and 5K runs. And over the last 6 years, I've done 3 high altitude Himalayan treks. When I say high altitude, it's all about 8,000 feet. Actually, all the treks that I've done have been around 12,000 plus feet. So, so what is it that I changed? And, while I've been associated with SHARAN since 2018, these were some changes that I did even before I came in to know about SHARAN, you know. And to briefly introduce SHARAN, many of you might be familiar, but some of you might be new around here. So SHARAN stands for Sanctuary for Health and Reconnection to Animals and Nature, and was founded by Dr. Nandita Shah, who is our speaker for today. And the whole purpose of starting SHARAN was when Dr. Shah realized that animals in nature don't really go to doctors or they don't take pills, but they have their ways and means of healing themselves, right? And the same principles she decided to apply onto humans and has seen remarkable results over the last 15, 16 years. We've at SHARAN have helped thousands and thousands of people heal naturally, not just with other lifestyle diseases like diabetes, hypertension, cardiovascular problems, but also with things like migraine and autoimmune conditions and joint pains and all those kind of problems. So I will share a little more about my own healing journey as we progress, probably during the question and answer session. But without much ado and without further delays, I would pass on the mic to Dr. Nandita Shah. Um, just to add, Dr. Nandita Shah is an Nari Shakti Puraskar Award winner from the President of India a few years back. And Doctor, are you here? Yeah? Can you turn your video on?
Yes.
Yes. So over to you, Dr. Shah. And just a request to all the participants, you can leave your questions in the chat box. We will be taking all the questions towards the end of the talk. And anything that you would like to share, please put it in the chat box so that I can share it with the with our speaker for today. Okay. Doctor, over to you.
Yes. Hello. Hi, everyone. I'm so happy to be here. And I hope you all can hear me. And also to share this talk with you. And also, I will share with you my personal experience. So, but let me get on with the basics right away. So, I'm going to share my screen. And Supraja has already told you a little bit about why I called the organization SHARAN, because I lived in a city, and when I moved to Oroville, where I live now on the beach, amidst nature, and lots of animals and birds, I noticed that animals in nature know how to be well and we don't. But we do. Instinctively, we do. And we can come back to those instincts. But we have to remove all our myths and all the learnings that we have had from our culture of disease. Today, we live in a culture of disease. And we are going to learn how to get into a culture of health. So today's talk is say no to aches, pains, and migraines. And I'm just going to stop my share and ask all of you before I go on that how many of you actually suffer from aches and pains and migraines right now?
Maya says, Vibha, you could just put an emoji or you could type in the chat box. Parul, Neetu, Ashwin, Carpal tunnel. Yeah, so there
Okay,
seem to be quite a few, doctor.
yes. And how many of you are already following Sharan lifestyle? Okay, a few of you. That's wonderful. And how many of you benefited from Sharan lifestyle? Okay, for some reason I'm not seeing my full chat box, but
But
do
there
let
are
me.
quite a few. There's Vibha, Deepti, Reshma, Neetu is just started, but she's confident that she'll benefit.
Wow.
Ashwin, Jakaria. There are quite a few, doctor.
Okay, that's wonderful. And so I'm going to ask some of you to share in the end also if you would like to. Okay, so let's get on with the presentation for now, and then we'll have a question and answer session in the end. But before that, Supraja will share her learnings, and I will share mine, and you will share yours, so that everyone can benefit from all of us who have already improved. Okay, so going back to this, say no to aches, pains, and migraines. So many painful issues that people are facing today that can be relieved, and we are going to talk about how. So, whenever we are in touch with pain, say you prick your finger, then there's a nerve from the finger which sends a message to the brain. Now, this is very important. The pain is important because the pain is to tell you that you need to change something. And if you move away, because the pain is going to force you to move away, because a secondary message will come back to the motor neuron and tell the finger to lift. So we are sending the sensation to the brain, and the brain is sending a message back to the muscles to move away, right? And once we have learned that the the pin is going to cause pain, we will never do that again. In the same way, when we get aches and pains and migraines and anything, it is only because our body is producing pain in order to save us. Our body wants to tell us something with that pain. And if we can learn what the body is trying to tell us and make the necessary changes, we'll never face that pain again. And that's what we're going to learn today. So, usually, when we have aches and pains, I mean, not you guys, I'm sure you all are much more knowledgeable, but most people reach out to painkillers. And so, before we go on, I just want to say that painkillers should never be the solution as far as possible, because the body has taken pains to produce that pain so that we can make changes. And if we take painkillers and the pain goes away, it will have to come back because we have not learned how to stay away from that pain. And the kind of painkillers we take are paracetamol and non steroidal anti inflammatory drugs called NSAIDs and antidepressants. They actually use antidepressants in order to relieve pain nowadays. And opioid painkillers, and these are highly addictive. Both the antidepressants and the opioid painkillers are addictive. And so, but even paracetamol, the reason we don't want to take a simple paracetamol is because that too can have some side effects. So, paracetamol, the trade names are Panadol, Calpol, Dolo 650, Crocin, Tylenol, you know all these things. And hopefully, you don't have any of them in your cupboards. But if you do, then let's learn about the side effects. Here's what I always suggest, that whenever you get a new medicine or you're prescribed a medicine, take it, take the name to Google and search for the side effects of that medicine. At least we should keep in mind what this can cause, right? So generally, paracetamol is safe, but side effects can occur, and overdose can cause liver and kidney harm. And long-term misuse can cause blood disorders and cardiovascular risks. But some of the common side effects, the side effects that do occur, remember side effects are not that common, but the common of all the side effects are gastrointestinal. It can cause nausea, vomiting, stomach pain, diarrhea, constipation, indigestion. It can cause general fatigue, headache, dizziness, and insomnia, and skin rashes or allergic reactions. So there are two reasons we don't want to take paracetamol. One is the potential side effects, and two, it's actually masking the pain, which was an important message to us. Now, infrequent and serious side effects of paracetamol are atelectasis, that means collapse of the lungs, spasms of the larynx, angioedema, abnormal liver function, abnormal nervous function, decreased lung function, irregular heartbeat, and trouble in breathing. Thank God that these are very infrequent. But honestly, even if some drugs have infrequent side effects, for example, vaccines have infrequent side effects, but the people who suffer from those side effects really suffer. And so, I think that it's really important to learn how to live without medicines rather than to depend on medicines for everything. And I was just thinking today that one more reason why we should learn to live without medicines or learn to listen to our body so that we can get free of the pain without medicines is because today in India so many drugs are spurious. That means you buy medicines, but inside there's only chalk or talcum powder, something that's innocuous, but of course it won't have side effects, but it doesn't have the desired effect either. And this happens so often. So let's make sure that, we avoid all this, because the people who make these drugs, you can't tell one from another. You can't tell the real one from the spurious drug. And usually they spend their time making the expensive drugs spurious. Like nowadays, we have Mounjaro, which costs a lot. So spurious Mounjaro will be in the market. But they even do it for these small things. And then non-steroidal anti-inflammatory drugs. The common names are aspirin, ibuprofen, or diclofenac, and ibuprofen has few names: Brufen, Ibugesic, Advil, etc. And here the side effects are more: indigestion, stomach pain, heartburn, acidity, ulcers, raised BP, and long-term side effects are cardiac risk and kidney damage. And then there are the antidepressants with all these names, hopefully less commonly used and not in our, uh, home drug cabinet, hopefully. But they have even more side effects: dryness of the mouth, blurring of vision, constipation, drowsiness, weight gain, excessive sweating at night, and they can be addictive. And then the opioid painkillers like tramadol, codeine, and morphine. And they have side effects like breathing difficulties, slow breathing, sleepiness, constipation, confusion, addiction, all the side effects of opium because they're made from opium. And so the main reasons to avoid painkillers are that they never address the cause. That means you have a headache, you take a painkiller, and then the headache comes back another day because you haven't addressed the cause. You haven't even thought about what the cause is. They can be addictive. That means once you feel better with the pain, next time you get the headache, you feel like reaching out for the same medicine. They have side effects, and they allow you to make movements or do things which could make the condition worse or chronic. For example, if you have back pain, why is your body producing the pain? In order to tell you not to make certain movements. But if you take a painkiller and go on making those movements, then you will actually be in trouble because the back pain will become chronic and maybe hard to heal. Now, to remove the problem, we should always address the cause of the problem. That means if you get a headache or a joint pain or back pain or any other pain, we should try to understand what is the cause of that problem and remove the cause. And that's what we're going to look at. When we take medicines, we're only treating symptoms. But if we don't remove the cause, the symptoms will come back. And therefore, we have to always think about the cause. So let's look at what are the causes of pain. And number one, most common cause, injury, right? And so obviously if you got an injury, you can't do anything, but it's like being aware. Like when you prick your finger, then you're aware that pins are prick fingers, and then you'll never do it again. So once we get a certain type of injury, like why are we afraid of fire or we want to stay away from fire? Because we know now that it can cause burns, right? And then inflammation. And we'll talk about the causes of inflammation. And lack of oxygenation. Whenever any part of our body is not getting a good oxygen supply, it can result in pain. And we all know this, like we know about angina and heart attack. When the heart is not receiving a good blood supply, it can result in pain. In the same way, if your fingers are not receiving a good blood supply, they can be painful. For example, in cold weather, or if we have inflammation, for example in lupus, if there's inflammation of the arteries, then you can have less blood supply to the fingers and you can have pain in the fingers, or pain, where like you can have pain when you're moving, like if you're walking and you're not getting enough blood supply to the toes, you can get pain. And then functional or structural disturbances, like for example, if there's a tumor that's pressing on some part of the body, it can cause pain. Or especially if you have a tumor in the head, it can cause pain. Or if the arteries are getting narrowed, and we'll see why they get narrowed, it can cause pain in different parts of the body. And of course, if you have something like an autoimmune disease, it can cause pain. And pressure from a growth like cancer or a tumor, it can cause pain. So let's first talk about injury. What should we do if we have an injury? Clean the part if it's an open wound. Minimize the movement that causes pain. Avoid painkillers and anti-inflammatories. Heal from within. Heal from within. So I'm going to give you an example of all this right now. And support or surgical help if needed. So I'm going to give you an example of my own injury. I actually had a bike accident. I fell off the bike and there was a lot of pain. I didn't think that it was serious, but it ended up being a fracture because the pain wouldn't go away. There was swelling. I went to the hospital. They did an x-ray. They found a fracture. Now, at that time, they prescribed me 5 different medicines. And, I also had a surgery, but that's besides the point. If you have a fracture, they prescribe you various medicines, an anti-inflammatory, a painkiller, and then some supplements and so on. So I decided that I'm not going to take any of these because I realized that the body knows what to do when you have a fracture. What does the body do when you have a fracture? It causes severe pain so that you cannot move. That's the best thing it can do. And the second thing is it produces its own plaster by producing inflammation and swelling, right? So that you, again, all that part is protected. And if we bring that down, rather than leave it to the intelligence of the body, we may have more problems. So the thing to do is make sure that the bones are together, and if not, put a splint or a plaster or anything that's going to hold the bones together. But make sure that you keep the blood flow going so that, the toxins can be absorbed, the new blood and the nutrients can go to the area and healing can start. Now, because I'm a homeopath, I also took a medicine called Symphytum, which is a really good medicine for fractures. And you can see here that you can get this kind of support or a splint depending on what is required, right? Just like if you are to get a sprain, you would need to do the same thing because you need to protect those ligaments from, stretching more or overexerting, and so that, they can heal faster. You want to minimize the movement to that area. And once you minimize the movement, the pain actually reduces considerably. So the pain tells us what we should not do. And now the doctors tell us what we should not do, and that's good. But our body was initially telling us, and we should always listen to our body. The second cause is inflammation. And inflammation, whenever you hear itis at the end of something like arthritis, it's inflammation of the joints, or you have chondritis, which is inflammation of the cartilage, or you have spondylitis, which is inflammation of the spinal cord, the spine, and tendinitis, inflammation of the tendon, and hepatitis, the liver, pancreatitis, the pancreas, meningitis, the meninges in the brain, the gastritis is the stomach, pneumonitis is the lungs, and vasculitis is the blood vessels. So whenever we have inflammation anywhere, it will cause pain. It's so that we recognize that something is wrong and do our best to improve it. Now, the causes of inflammation can be, again, injury, and we talked about that. It could be an infection, an acute or chronic infection, or it could be because of inflammatory foods. Today, so many people are going around with inflammation in their body because of the foods that we're eating in our culture of disease. Meat, fish, dairy produce free radicals that cause inflammation. And then acid yielding foods, sugar, tea, coffee, colas, alcohol, smoking, and of course, even high protein breaks down into amino acids and is acid yielding in our body. And then certain diseases, high blood sugar, cardiovascular problems can cause inflammation inside the blood vessels, which can lead to a whole host of problems, which is why people with diabetes can get so many problems, from eye symptoms to amputations because of lack of circulation, or cardiovascular problems, etc. And then chemicals and medicines can also cause inflammation. In fact, so many times we take an antacid because we're taking medicines that are going to cause inflammation in the stomach. And then autoimmune diseases, which have become so common these days. And the main causes of autoimmune diseases are, number one, proteins that are foreign to our body, and number two, vaccinations. And I should mention number three these days, which is an organ transplant, because so many people are having organ transplants. So any of these can produce an autoimmune reaction, and honestly, so can certain medicines and certain viruses. So, we want to avoid whatever is the cause. Like, for example, if the cause is diabetes, let us work on diabetes. And if we want to get rid of diabetes, there too we shouldn't work on getting rid of the diabetes by taking medicines, but we should understand what are the causes of diabetes or insulin resistance and get rid of that. And that's another topic altogether. But in general, if we were to take responsibility for our body, just like animals do, then we can heal almost anything if we just listen to our body and take charge, and listen to our instincts and stop listening to the whole world. So I'm going to show you an image of a healthy joint where you see two bones coming together. This could be a knee joint, it could be a finger joint, it could be any joint. And so, there are two bones, so that these bones can move and you can get the movement of the joint. And this is moved by the muscle, which is connected to the bone through the tendon. And between the two bones, there's cartilage. And this is wrapped in a joint capsule which encloses synovial fluid. Now remember, this synovial fluid is not fat, and we don't need fat to lubricate joints. We need synovial fluid, and synovial fluid actually nurtures the cartilage. The cartilage doesn't have a blood supply, but the synovial fluid nurtures the cartilage by giving it nutrients and taking out detoxing, taking out all the toxins, and the fibrous capsule around it has the blood supply. So all of this is orchestrated in a beautiful way, with every joint working to perfection until we have problems. Now, even in the lumbar spine, it's the same. The reason we can bend our back is because we don't have one bone, but we have a series of bones with intervertebral disc, which is like a cartilage and which contains a fluid inside. And this is flexible so that the bones can move against each other or backwards. But sometimes when we don't have enough blood supply or nutrient supply in this area, then here too we can get a prolapse of the intervertebral disc and we can get pains. So what do we do if we have that? We should stretch the area so that we increase the space, and then we should do everything to improve the circulation so that it gets better fast. Then sometimes people have gout, and gout means that there are uric acid crystals in the joint space. And where does uric acid come from? High protein. Like protein breaks down into uric acid, blood urea nitrogen, creatinine, and urea. 4 things that go high when we have kidney disease, because excess protein is actually toxic for the kidneys and the kidney has to flush it out. But if we're having too much protein, we can end up with these kind of problems. And which is why it's so important to understand that nature is perfect. Nature would never expect us to have a protein deficiency if we are eating right. And so we never need to take a protein supplement. Like if you feel that you don't have enough protein, then you should be thinking, what does my body need which is natural for my species that would give me the protein? And you don't even have to think about this, because your body will automatically point you to the foods that you require. But your trainer may point you to high protein supplements and so on. Right? So anyway, back to gout. When we have gout, the joints become red, severely painful and swollen, and often doctors give medicines to reduce the uric acid. But what should we do? We should remove the cause of the high uric acid. Avoid excess protein, avoid alcohol, which can also cause it, and avoid too much sugar. Avoid sugar in general. That does not mean we need to avoid sugar in fruit, because fruit is something that nature has provided to us, and whenever nature provides us something which has too much sugar, it also provides a lot of fiber, so that when we consume, say we consume sugarcane, then sugarcane, if you consume in nature like this and like this, the fiber prevents you from eating more than 6 to 8 inches. But if we process the sugarcane by peeling it or making it into juice, or still worse, jaggery or sugar, then we are going to get excess without the fiber. So remember, the fiber is the thing that saves us, and fiber is always produced only by plants. There's no fiber in animal products. And wherever there's excess sugar, there's more fiber, and so we will never eat too much sugar if we eat foods in the whole form. But if we consume extracts, we can have too much sugar. That means you can even have dates, because dates have fiber, but date syrup does not. Okay, so that's gout, right? Then the other problem is rheumatoid arthritis. So many people have rheumatoid arthritis, and rheumatoid arthritis is actually an autoimmune disease. Autoimmune disease means that our own body antibodies are destroying our cells. Here you can see that the thinning of the cartilage and even the destruction of the bone has occurred because of rheumatoid arthritis. And rheumatoid arthritis also causes inflammation in the synovium. And the cause of rheumatoid arthritis is actually an autoimmune disease, which causes swelling and tender joints and stiffness in the joints especially in the morning, and if it lasts more than half an hour, it's likely to be rheumatoid arthritis. And severe tiredness and fatigue. We always have fatigue in autoimmune diseases because the body is fighting with itself, and this usually ends up as fatigue and a general feeling of being unwell. Now, there are other autoimmune conditions that can also cause pain: ankylosing spondylitis, psoriatic arthritis, juvenile idiopathic arthritis, lupus, fibromyalgia, polymyalgia rheumatica, multiple sclerosis. This is just to name a few that can cause pains in the joints. And how to heal autoimmune conditions is remove the foods that are not suitable to our species. And I'm coming to that. And for anyone who has an autoimmune condition, I do want to say that on our YouTube channel, if you go to playlists and search by playlists, then you will find a whole playlist on autoimmune conditions, and there are talks by me and others about how autoimmune diseases are caused and what you can do to get rid of them. Okay, so let's talk about the compromised blood supply. And this is an artery that shows how the blood vessels in our culture look over time. This is the first decade when you can see that the artery is getting some degree of narrowing, and then more narrowing and more narrowing, and even more narrowing by the third decade. And by the fourth decade, considerable narrowing. By the fourth decade, when we're 40 years old. And do you know that until our arteries are 70% blocked, we don't even get symptoms. But now, we are blocking our arteries so fast that we are causing lack of blood supply to various parts of our body. We're getting high blood pressure and even heart attacks and stroke. So lack of circulation is what we have to work on the most. And I already talked about, when our arteries get blocked in the heart, we get a heart attack. But when our arteries get blocked anywhere else, say in your calf muscle, then you're going to get pain in this area. And so we have to keep working on getting rid of this. Now, in order to improve the circulation, what do we have to do? We have to avoid whatever's blocking it, which is fat. When fat goes into our arteries, it thickens the blood. And the thickened blood injures the artery walls. And this injury is bandaged with cholesterol, and over a period of time it gets narrower and narrower. But imagine if we want to use oil, ghee and butter, which are anyway not our foods because they are produced by processing. Ghee is a part of milk. Butter is a part of milk. Oil is a part of oil seeds. It's not a whole food. It lacks the fiber. As I said, all animal products lack fiber, but even plant products lack fiber if they are refined like oil. Now, nature is very smart. Whenever we consume fatty plants, if we consume them in the whole form, there's lots of fiber. Say you consume avocado, you consume peanuts, almonds, cashews, mustard seeds or sesame seeds. They all have fat, but they have fiber. And the fiber holds on to the fat, as opposed to animal products where there's no fiber and so the fat is free. So if you boil animal products, meat, fish, chicken, or milk, you will get fat on top. But if you boil any plant, coconut, peanuts, cashews, you will not get fat on top because the fiber holds onto it. If we eat plant based foods, even if they're fatty, it will not cause a problem because the fiber is holding on to the fat and it doesn't allow the fat to go straight into the bloodstream. So we need to avoid meat, fish, chicken, eggs. Avoid all kinds of dairy. Dairy means milk, cheese, butter, cream, paneer, ice cream, curds, buttermilk, ghee, or anything made of these. And then we need to increase the fiber, and we can increase the fiber by eating whole foods, foods that have not been refined, fruits and vegetables without peeling. We would peel only that which we can peel with our bare hands. And exercise. Exercise helps to improve the circulation all over the body, and that's so important to avoid joint pains. And then vitamin B12 deficiency, because this can cause blockage of the arteries. And of course, we should avoid inflammatory things. And we talked about them, the meat, fish, chicken, eggs, dairy is inflammatory, but also medicines can be inflammatory, and certain diseases cause inflammation. And so we should work on all of these things. And then osteoarthritis. Supraja was saying that when she was 30, her doctor diagnosed her with osteoarthritis. And she said, I was too young to get osteoarthritis, and we still have to hear her story. But in osteoarthritis, you get bony spurs called osteophytes. And the cartilage gets thin and the bones could rub against each other and cause problems. And usually this is considered a disease of aging, but truly we don't need to get osteoarthritis when we're aging either. It can be a result of joint overuse or injury, and of course for that we can't do much. But we can be aware never to overuse the joint. Like if you're getting pain, don't run. Heal the pain and then do your running. Or obesity. Obesity puts so much pressure on the joints, and this can cause problems. So let us work on the obesity. And of course, genetics. But honestly, genetics is not the main cause of osteoarthritis. Genetics is just the gun that we need to never pull the trigger of. And then bone deformities, of course, we can't do anything about that. And sometimes, you can get, if you have bone deformities, you can get special shoes to avoid that pain. Because we should always do something so that the pain doesn't get worse by rubbing, two bones against each other or rubbing the bones against the tendon. And metabolic factors like diabetes or high iron can cause this. So remember, we should never take supplements also just like that. And sometimes when we take one supplement, the other thing goes down. Like if you take too much iron, calcium can go down because iron and calcium compete with each other. And then post-menopausal women. To tell you the truth, every post-menopausal woman has some degree of osteoporosis, and this cannot be helped. This is because of the change in hormones, but it need not cause symptoms if you are careful. And for this, it's really important to it's not important to get more calcium, but it's important to get enough vitamin D, which is a hormone which helps us absorb calcium. And therefore, two vitamins, vitamin B12 and vitamin D, which we can't naturally get in our unnatural culture of disease these days. We must check and supplement if necessary. So, for osteoarthritis, what do we need to do? We need to lose weight, avoid fat, maintain a healthy weight, strengthen the muscles. And this can be done by, as Suprajat said, exercise, marathons, strength training exercises, swimming, honestly, whatever you enjoy. And avoid joint strain. And avoid joint strain. Now, headaches. What are the causes of headaches? And I'm sure that many of you know this, so I'm going to ask you, what are the causes of headaches? Would anyone like to share? What causes headaches for you?
Neetu says acidity.
Yes.
The sun, Radhika says,
Absolutely.
worries,
Worries,
stress,
stress.
dehydration, hunger, noise, high BP,
Thank
dehydration,
you. Thank you.
blood
Blood
flow
flow
shortage.
shortage, yes, and that can also be because of dehydration or high blood pressure. Strong smells, thank you for that.
Lack of sleep. Prajni says lack of
Yes,
sleep.
absolutely. And so you all know the solution, right? Unnecessary tension, indigestion, loud noise, exactly. See, that's what I said, that we all know how to cure ourselves. So let's never reach out for those painkillers again, and let's always work on curing ourselves. Right? So you probably wrote more causes than me, but here are mine: stress, dehydration, poor sleep, muscle tension, dietary factors, bad nutrition, too much fat, eye strain, hypertension, pollution. Also, strong smells is a pollution. Like, I remember someone came into my office with strong perfume, and I started to get a headache because my body knows that perfumes are toxic. Everybody knows this, but sometimes we've been taught that perfumes are good. And if we keep thinking perfumes are good, we can even often avoid those headaches. But the headaches come to let us know that the perfumes or the strong smells are not so good. And then dietary factors, that came twice, sorry about that. And then tumors, injuries, hemorrhages in the head. Right? That, of course, if you have an injury or if you have a headache that just doesn't go away after you have removed all the causes, then we should get it checked. And migraines are a special kind of headache which has it's a half-sided headache usually, with throbbing, pulsing pain, and it's often accompanied by nausea, vomiting, extreme sensitivity to light or sound or to other triggers. And the causes of migraines are known to be cheese and chocolate and fatty foods. We know that fats can cause problems. Cause of migraine can be dehydration, being out in the sun, or lack of magnesium. But if you're following SHARAN lifestyle, when we start the day with green smoothie, and greens have plenty of magnesium, you should not get this problem. And magnesium is good for many things. It's really important, and it's also good to get good sleep. So green smoothies is a great way to start the day. And then lack of routine, delayed meals, or other routine, lack of sleep or delayed sleep. Or I knew one person who used to get migraines from Like if he had to put an alarm and get up to go to the airport or anything, he would get a migraine. So there are different triggers for different people, and we need to find our trigger and then avoid it, and then make lifestyle changes that I'll soon talk about, so that we get away from it. And if stress is the cause, let us all work on our stress and emotional disturbances. And honestly, this is a lifetime of work, right? If you solve one problem, you will get the next, because we're here to learn to solve problems. So let's get on with it and keep solving them. Because when you don't solve a problem, that problem comes back in a new form. So, like for example, you have a certain kind of boss and it's causing emotional problems to you, and you leave the job. The chances are that if you haven't solved the problem, you'll get a similar boss in the next job. And the same can go with for spouse or anything else. So what is the solution? That we need to work on ourselves. We need to understand the cause of our stress. We need to understand the cause of our disease and remove it. So what can we do to minimize aches and pains? We should minimize fats, especially free fats that are found in animal products as well as oil, ghee and butter. Increase the fiber. Make sure that vitamin D is checked and supplemented, and vitamin D should neither be in excess nor in deficiency, because it's a hormone. Vitamin D incidentally also helps with osteoporosis or prevents osteoporosis, helps with calcium metabolism, and also helps with sleep. And by the way, it also helps prevent diabetes. And then exercise. Like, why do we have these limbs? In order that we can move. And like, I got a fracture, and so I was not allowed to move my leg, and then the muscles can atrophy. But it's really important to heal the bones and then start working on the muscles. But if you're able to, you can even do muscle exercises, certain muscle exercises. Like, I had a surgery, so I was allowed to do movements. I just wasn't allowed to stand on my feet because it was a knee fracture. So I wasn't allowed to do weight bearing, but I was allowed to bend and, open the knee. And because I did this, when I started to walk, it wasn't very difficult. We should rest and get enough rest. And even if we are, doing marathons and all of that, we have to keep a couple of days to recover. Recovery is as important as exercise, and sleep is as important as exercise. And avoid painkillers, and honestly avoid all medicines, and plenty of hydration. And if we are using RO water, which most of us are, and sometimes when we're not using RO water, we're using water with chlorine or other chemicals, it's harmful as well. So RO water is good, but it would be good to add something to it, something which just to put some minerals back into the water, so that we can it'll be isotonic in our body, and so that we're not leaching minerals out to neutralize the water, to make it isotonic. And then we should work on stress and our triggers, and avoid protein and calcium supplements. I can't emphasize this more. If you need more protein, eat beans, greens, nuts, seeds. All of these have protein. In fact, it's hard to get protein deficiency. And calcium supplements. Never take these because there is no known dietary deficiency of calcium in the world. The deficiency is in uh, absorbing the calcium due to lack of vitamin D. So check and supplement vitamin D. So Sharan has a 5-point plan that everything should be plant-based, everything should be whole, everything should be organic, vitamin B12 and D should be checked and supplemented. I want to say a word about calcium and osteoporosis. Remember, we're stopping dairy, and so many people think that you need milk for calcium, but it's not true. So this diagram shows osteoporosis, where you see that the bone has become a little more cheese-like, a little more brittle, more holes in it. And I do want to say that if you look at this chart, you can see that human breast milk, which has more than enough calcium than we could ever need, because remember that the human baby is, it's born without any bones, right? So it has to build its teeth and bones, and so the human baby doesn't need more than 33 milligrams per 100 gram portion. But all nuts, beans, seeds have more calcium than human milk, as you can see from this chart. And even potato chips, which we should never eat, have more calcium than human milk. But so do sesame seeds. Sesame seeds have 10 times more calcium than cow's milk, which, by the way, many other things have more calcium than cow's milk too. The only thing that cow's milk has that sesame doesn't have is a lobby. Remember that we are told to buy products because of the commercial nature of our culture, but we don't need it. So where can you get all the nutrients and all the calcium that you need? From beans, greens, tofu, soy milk, all the Brassicaceae family, the cruciferous family, the broccoli and the dill and parsley and even cabbage, and the figs and oranges and raisins and dates. These are things, chia seeds, these are things we're eating anyway, and therefore we never have a calcium deficiency. Now, deficiency, how can Sharan support you? So I just want to say that if you, after doing all this, still have aches and pains or migraines, we have consultations and we can help. We'll look to find out what is the cause and help you remove it. We have cooking classes to teach you how to cook without oil or sugar and make wonderful food. And we have retreats, and our 21-day health retreat is coming up now in June. And that's a place where not only do we put everything in place, but we make sure that it's sustainable. You learn, like we have cooking classes every day, and yoga and meditation and fitness and mental fitness and learning and everything that you can imagine, so that you can recover from diseases and never hopefully get sick again. So with this, I'm going to end. I thank you for being there with me, and now I'd love to answer some of the questions.